Welcome to this great partnership between Brenner and Northwest AHEC on childhood obesity prevention and treatment. This first part will be about feeding children. My name is Joey Skelton. I'm the director of the Brenner program. I'm an associate professor of pediatrics as well as epidemiology and prevention, and I've been doing pediatric weight management and research for about 15 years. I have no conflicts of interest or any other financial disclosures to make. Our learning objectives for this section is to learn why restrictive feeding does not work, understand ways to be helpful with childhood feeding, learn about Ellen Satter's division of responsibility model, and learn how to apply that model in a clinical setting as well as especially in working with children and families who are struggling with weight. So first of all, this is something that we say often in pediatric weight management. Children are not little adults. You as primary care providers have probably said the same thing. We really understand that the tools and tactics for adults to lose weight may not necessarily be safe for children. Cutting calories and dieting, limiting portions, daily weighing, and lots of exercise is oftentimes needed for adults to lose weight and keep it off. However, this does not work with children and can even be harmful. Children are still growing and developing, and learning about health and habits is a new concept to them. Losing weight quickly can be harmful, both emotionally and physically. Cutting too many calories or eliminating whole food groups altogether can actually slow down metabolism and potentially affect physical as well as emotional development. Dieting behaviors can cause harm to children's self-esteem and body image and can lead to eating disorders and depression. So overall, restricting intake is not suitable for growing children. Weight that is lost in this manner will be gained back and likely at a higher rate. Restricting intake disrupts children's internal hunger and satiety cues. Pressuring children to eat less or only eat certain foods backfires and often leads to sneaking and hiding food, food preoccupation, decreased self-esteem, and disordered eating in the long term. Pressuring parents to make extreme changes to help their child's weight can often strain family relationships. Children may damage their metabolism, not get the nutrients and calories they need to grow and develop properly. And parents, as well as care providers, using words like obesity, unhealthy BMI, or having a weight problem or excess fat when talking about weight concern makes families feel less motivated to make changes. Pressuring children to exercise makes them like it less, and actually they're going to be more likely to exercise in the long term. And then scaring children and parents into making changes backfires and has the opposite effect. Families either give up trying to make changes or attempts to lose weight in dangerous ways. And about restriction, and when I talk about restriction, what I'm really referring to is telling people or forcing kids to eat less, to not eat certain foods, or to eat more of a certain food. So restriction, overall, the science is actually done. When a child is identified as having overweight or obesity, that leads to parents and others restricting that child to eat certain foods or to eat less calories or pressuring them to eat healthier foods. And when we do that, the child gains even more weight than if we made no changes or made pressure at all. I only list 2 studies there, but overall there's a huge body of literature that says when we do that, we identify a child as being overweight or obese, we restrict the calories that they're getting, and it leads to even more weight gain than they would have had if we'd done nothing at all. Now this one's a little complicated, but what it really shows is that when children are overweight or obese, especially as they get older, they have a high likelihood of that obesity continuing into their adults. So if you follow on the x-axis a 14-year-old child, and you go up the y-axis and they have a BMI of about 26, they're at the 95th percentile for their BMI, which means they fall into the category of obesity. So if they're at the 95th percentile at that age, you can see that darker line, they have a greater than 80% chance of being overweight or obese as a young adult. So if we start to mess with that by trying to force weight loss by restricting calories or pressuring to eat healthy foods, you're actually going to increase that risk that they grow into an overweight or obese adult. And this is very important to know because oftentimes we're really getting desperate when they're getting older, and we're so fearful of them being overweight or obese as adults that we'd start trying to force them to lose weight. So just know that we're actually going to increase that chance of them being overweight or obese if we try to force or restrict them into eating less. So we really, as with all pediatric weight management, is we want to focus on parenting, and it's really a new target for intervention. There's numerous studies linking parenting and obesity. And for one small example, that high levels of parental warmth are associated with a decreasing or stable child BMI and treatment. So if we don't cause conflict between the parent and children in trying to lose weight, we may actually have a better chance of getting that child to lose weight. Parenting alone can be a focus of obesity and obesity prevention. And the modification of parenting variables show promise in obesity prevention. So there's so much and so many more ongoing studies that show that working with parents to maybe adjust how they're parenting their child can actually have a positive long-term outcome. So how can a healthcare provider be helpful for parents and children who are struggling with weight? So encourage small changes one at a time. Don't try to change too much. Allow families to choose where they want to begin making changes, and this falls with motivational interviewing, trying to get them to identify the changes that they want to make. Teach families to follow Ellen Satter's division of responsibility when feeding an activity, and we're going to talk a lot more about that. Specifically, what is the parent's role, which is what I like to say, how the family is eating, and then what is the child's role in deciding how much and whether to eat and be active. This helps end the fighting and conflict over food and can improve relationships. Providers can encourage parents to provide structure with eating rather than pressure to eat less by controlling portions, counting calories, and cutting carbohydrates. As we talked about in the slide before, parenting works. As a provider, take a slow and steady approach to help families make changes, understanding that habit change is complex and takes time. When talking about weight concerns, use words like weight, extra weight, and BMI. Family meals. What are family meals like for your patients? What are the barriers to families eating family meals? So in your group, take a few minutes and turn to the person beside you or as a whole group and talk about what a patient has told you about their family meals. I'm going to give you about 2 minutes to discuss. Okay, hopefully that gave you guys enough time to talk. You're welcome to pause this if you're in a good conversation about it. But what are some of the things that you guys talked about? Some of the things that we oftentimes hear about how family meals are like for our patients, they're non-existent. They don't eat together. They grab their food and they go to their rooms, or they're all on different schedules and eating on their own. They eat in front of the TV. They eat in the living room. They all eat in different rooms. What are the barriers to families eating family meals? The parents or the child's schedules. The parents may work late or they work different shifts. They have extracurricular activities that keep them very busy in the evening hours, and they don't have time to sit down and eat at a reasonable time. They don't eat at tables. They all either eat in the living room or in front of the TV. Maybe they have trouble with food, and they aren't able to really to plan family meals together. Maybe family meals can be stressful. Maybe they fight the whole time and argue, and so it's actually easy for them to not eat together as a family. So overall, the purpose of this is really to think about and maybe explore this with your families, to just say, tell me about mealtime in your family. Tell me what that's like. So another group question. Take about 2 minutes to read this scenario together and discuss what you think this parent is thinking and feeling and deciding about himself or herself as a parent. I'll give you about a minute to read and then about a minute of discussion with the group that you're in about this scenario. Okay, if you guys need some more time, you're welcome to pause it, but we're going to go ahead and talk a little bit more about this. So um, some of the things that we hear when we ask this question to our team, asking what the parent is thinking. Their child eats too much. I'm the food police. My child is gaining weight. They're scared. They're confused. They're overwhelmed. They don't know what to do because every time they feel like they're helping or trying to help, it's causing conflict within the family. And then what are they deciding? I'll stop him from eating. I will be the food police, but I'm a bad parent. I'm a failure. Does this sound familiar to you guys? Is this something that you hear when you're talking with parents of kids who are struggling with their weight? It's a common scenario that we tend to hear in our program. So again, this is another scenario. I want you guys to read. I'll give you about a minute to read. And then I want you to discuss as a group for about a minute about what this child is thinking and feeling and deciding about himself or herself as a child. So go ahead and read it now and discuss. Okay, we're going to go ahead and move forward. If you want more time to discuss, feel free to pause right now. What do you think this child's thinking? Mom is mean. How does she know what I need to eat? She doesn't know how hungry I am. The child feels frustrated, it seems like, or mad, and then even embarrassed about getting that look from his mom when he's eating another bowl of spaghetti. And then what's this child deciding? Maybe I'll eat it some other time. I don't want to eat in front of my mom. I'll sneak it later. So a big thing to understand here, the child is more focused on what the parent is thinking and thinking somewhat in a negative way about what he or she is eating. They're more tuned into the parent instead of their own hunger and to enjoying their food and actually listening to their body when they're feeling full. So it's a great example of showing how this tension can actually cause a disruption of hunger and fullness. So now to Ellen Satter's division responsibility, or what we'll see abbreviated as SDOR. Um, and what it boils down to with this division is what is the parent's role in feeding and what is the child's role in feeding. Ellen Satter is a registered dietitian who became frustrated with what she was seeing and then developed this model, not in regards necessarily to obesity, but can be used with picky eating or undereating, overeating. It really focuses on how we can move from being restrictive to non-restrictive in our feeding relationship. So she was specializing in weight loss early in her career, and she was quite saddened and disheartened by the yo-yo dietings and feelings of failure that was felt by her patients. She also saw the rising eating disorders from people who kept having dieting failures. So then she went back to school to become a family therapist to better understand and address these issues. She developed this approach to feeding children using basics of parenting, feeding dynamics, and child development. She really dove into the research to determine what is going to predict the healthiest feeding dynamics between a parent and the child. And that's why you'll see sometimes her models being called feeding dynamics or eating competence or the trust model. So in looking at child and food regulation, there's a lot of research that backs up what she's put into place with this. And this is just a sampling of what we see when parents try to restrict children in what they're eating and the effect that it has. That under stress, when children are restrained, that we're trying to get them to eat less, they actually end up eating more than children who aren't being restrained. And then Leanne Birch and her colleagues, who's been doing this research for 25 plus years, show that when children compensate for a calorie preload, that really how much they eat is oftentimes not going to be affected by how much they eat early in the day if we're actually trying to restrict that, if we interrupt their natural hunger cycle. A later study in 2009 shows that adiposity or fatness or obesity is not associated with necessarily fatty foods or eating fruits and vegetables. I'm not saying that's not important, but when it comes to total caloric intake, these foods that we try to prohibit, like fatty foods, or push, like fruits and vegetables, may not be as important in determining weight as actually other behaviors behind that. And then increased control of food increases weight, while decreased control of food actually decreases weight, which really shows the point we've been trying to make, that if we try to really control what food goes in our kids' mouth, it's going to end up backfiring. So back to Ellen Satter's model. A parent is responsible for what, when, and where, and these roles remain constant. The parent is always responsible for what, when, and where. We'll go into more detail on each of these, but let's start with the when and where versus the what. The when and where is just as important as what we are offering our children. So let's talk about the role of the parent, when and where. So when comes down to when eating is allowed. That's regular and predictable meals and snacks. We make eating a priority, not just when we have time or when we're hungry. We want breakfast, lunch, and dinner, and 1 to 2 snacks in between. When we eat a meal is important because it helps us come to each meal and snack hungry, but not too hungry. When we're too hungry, we tend to overeat and we tend to choose foods that aren't as good for us. When children snack throughout the day or grazing, this prevents them from recognizing hunger and fullness cues and leads to overeating in some and undereating in others. Grazing will also lead to pickiness at a meal because if they're filling up on crunchy, salty, or sweet snacks, they may not really be that interested in the balanced meal the parent's trying to serve. There's a saying that hunger is the best spice. Your role is to create the structure and help them to follow that schedule and structure. If children are older, involve them in creating that schedule. They are more likely to follow a schedule that they help create. And then what about where eating is allowed? The long-term goal is to have family meals at home at a table without distractions. Distractions might include TV, phone, tablet, homework, books, computers. You want to start where you are now and slowly transition to the long-term goals. So an example of that would be turn off the TV at dinner while continuing in the living room. So if the family's used to eating there, instead of eating with the TV on, try turning the TV off before you try to move over to the dinner table. Once you get a habit of that, then you can move to the kitchen table for dinner, but maybe leave the TV on that they can see it in the other room. So maybe try the reverse approach. If the family eats out a lot, maybe don't start with trying to cut out eating out altogether, but try to eat at home together once a week more than you're presently doing. Research shows that eating together as a family improves communication, decreases pregnancy, use of drugs, increases fruit and vegetable intake, decreases intake of fried foods, and improves school performance. Eating at the table for meals and snacks without distractions help kids tune into their hunger and fullness rather than being tuned into the distraction. So for the group, ask yourselves, have you ever eaten a bag of chips in front of the TV, then all of a sudden they are gone? I know my family does that with popcorn on movie night, so we can expect the same of the families that we're taking care of. Eating at the table also slows the eating pace and helps us eat the right amount of food for our bodies. So finally, the role of the parent is what food is provided. So steps to take with trying to address the what. First, just provide the food. Provide what you're normally already eating. Gradually move towards more nutritious recommendations. We'd prefer people focus on the where and the when rather than the what to begin with. So start by providing the food that they're already providing. You probably expect me to talk about calories and portion sizes. As a parent, their job is to provide satisfying foods that the family enjoys. We eventually would love for all of you to offer a balanced meal and know it takes time to get that in place, but we don't expect families to be able to do that at first. Don't worry about what you should be eating. I know this sounds crazy, but right now, families shouldn't worry about the shoulds. This is what stops us from making any changes, because making that change to what we should be eating can be very difficult and disrupting to the family schedule. You can't change it all at once. First, work on changing where and when. Then families can change what they're providing. Eventually, we can work on any nutrition changes you're interested in working on. Be considerate to likes and dislikes without catering. So be considerate to what the family likes and dislikes by planning and preparing in advance. Avoid offering substitutions like a peanut butter and jelly or a yogurt if the child does not like what the parent is first offering. If we offer substitutions to what we're being offered as a meal, they'll never learn to like what is offered, because if they know they can hold out from what you're serving to get that peanut butter and jelly, they'll do that every single time. When planning and cooking, be considerate, but avoid catering to everyone's individual preferences. An example is you want to make your child macaroni and cheese and green beans. Make sure each child has something on the plate that they can make do with if they're not sure about what else is being served. Avoid making individual side dishes to satisfy everyone. Parents aren't short-order cooks. What you're doing now is okay, whether it's out to eat or cooking at home or making sandwiches. Stick with what parents are providing now, and we'll make changes down the line once the when and the where is in place. So, a parent has conquered the when and the where. Are they ready for the what? So how to know when families are ready for the what. 1, meals and snacks are on a schedule. The family's eating breakfast, lunch, and dinner, maybe with 1 to 2 scheduled snacks a day. They've made eating a priority. No one's skipping meals or snacks, and no one's grazing in between meals. Getting that eating schedule is a very big one for families. Meals and snacks are eaten at the table without the distractions of TV, cell phones, or video games. And the biggest one, and oftentimes the toughest, a parent is trusting their children to eat the amount that they need. That's a very tough one to do, but it's very important for this to work. We'll discuss the child's role with eating just in a minute. So we've talked about the parent is responsible for what, when, and where, and the child is responsible for how much and whether. As a parent, their job is done when the what, when, and where is taken care of. When parents do those 3 jobs, we can set our children up to be able to do their jobs of deciding how much they will eat and whether they'll eat at all. This can sound really crazy and really scary, especially if you're worried your child will eat too much or not enough. The role of the child and how much they eat. This can be really scary for parents, and it can be tough for us as care providers to process when a child is struggling with weight. So how much they eat. A child, from the food they are offered, they get to choose how much they want to eat out of the foods being offered. They're allowed to have seconds without having to eat their vegetables to get it. They can continue to eat until they are satisfied from what was prepared for dinner. And there's a lot of difficulties with this. So for example, here's something you're likely to hear. I'm concerned about my child's weight, and you're saying they can eat as much as they want? Well, yes, the long-term goal is for your child to be able to recognize feelings of hunger and fullness. If we always stop them, we get in the way of that, and they can't learn to do this for themselves. They're more focused on you as a parent and what you are saying versus what their body is feeling. Remember that from before with the child that was concerned about eating spaghetti in front of their parent. Keep in mind, they're not getting to eat however much they want because your job as a parent is to set up the structure and the timing of meals. They only get to decide how much within that structure that you create, and it's setting up that structure where it really works. Some other difficulties that you might hear. All they're going to eat is the meat and the starch. Well, at first, and possibly for a while, that may be the case, and they may only eat the meat and starch. But what we know is they will eventually become more curious. Since there is less pressure, they will get more interested in trying new foods, including vegetables. Or if they eat so much that they get sick, well, what do you think they're going to learn from that? If they eat too much and it hurts their stomach, then they may not do so much next time. So next time they're offered to eat that spaghetti they love so much, they only may eat 2 bowls. We have seen over and over in our program, if that restriction is lifted, that hunger seems to increase very shortly, but then it actually goes away and the parents notice, wow, they're not eating near as much as I thought that they would. What about snacks? Well, this concept applies to snacks as well. As the parent, you're in charge of the schedule and structure of snacks along with what is offered for snacks. Once it is snack time, you allow your child to decide how much to eat from the snack that is offered. This can be a big change because typically we think of snacks being salty, crunchy, or sweet. But as parents are putting this into place and they're planning a snack, they can plan to serve snacks that they're a little more comfortable with while still allowing to have some of those forbidden fruits, which we'll talk about more later. So this is going to be different from how a lot of us, either as parents or as medical providers, of how we were raised and how we grew up. We may have been raised with the clean the plate club, or before you can have seconds, you have to eat everything on your plate, or maybe do a no thank you bite of that food that you don't really like. We want to avoid having rules like this around foods and meals. If we make a lot of these rules, kids are going to try to break them. Avoid making the meal about the food and make it more about being together as a family. Now, some rules that we do like that you can put into meals: that there's no electronics at the table, no comments about how much someone is eating or what they're eating, everyone comes to the meal, and avoid topics that are going to lead to conflict, like maybe grades or homework. Meals should be a time for family to enjoy spending together. Now, the role of the child. So this, again, can be scary and want to give everyone time to sort of process this. So the other role besides the how much is going to be the whether they will eat at all. The child can choose to eat as much or as little from the food that is offered. Avoid offering a substitute if the child chooses not to eat what you have prepared. Sit at the table for an appropriate amount of time, even without eating. And parents stick to scheduled meals and snacks if the child chooses not to eat. So some difficulties you're likely to hear about from this is, what if my child doesn't eat at all? Do I send them to bed hungry? Well, yes. Do you think your child might learn that what will happen if they don't eat dinner? And we know that your child is not going to starve just by not eating one meal. We want them to learn to be able to make do with the food that is provided at the meal. Also, as a parent, the job is to be considerate with the what, so you're confident that there's at least one food on that plate that they can make do with if they don't like the others. Another thing a parent might say is, if I never make them eat their vegetables, they're never going to try them. We find that the more we try to remove that pressure, the more likely kids are to trying new foods, including vegetables. Remember, it takes upwards of 15 or more times of offering a food before a child will eat them regularly. So offering the food is important, even if you aren't sure that they will choose them. They will never eat a piece of broccoli if it is never served. Role modeling is also important. They'll never learn to like foods if they don't see you eating those foods yourself. So remember, you want to focus this on trusting the child, which can be very difficult for parents. So parents should trust themselves, they need to trust their child, and as your medical provider, they need to learn to trust you in offering these recommendations. So oftentimes for parents, this involves letting go. Let children decide how much to eat. It's the child's responsibility to decide whether to eat how much or how little from what is provided to them. Step out of being the food police and trust your children to eat. That can be very helpful to parents to realize they don't have to be the food police. The key is to trust your child to choose for himself or herself. Stepping out of being the food police and into the new trusting role takes time and practice. There are no food rules. Do not have to clean their plate to get dessert. Do not have to taste everything. Do not have to eat all your vegetables to get seconds, and so on. Enjoy the food and trust that your child will eat what their body needs. Make meals pleasant by focusing on the family at mealtime. Avoid talking about food and focusing on connections and with each other. More doing and less talking is our goal when parenting around food. How do you talk to your kids about food, health, exercise, and weight? Well, between the ages of infancy up to 16 years old, it is more about doing than talking. What about desserts is a common question. And this is where actually you can put a little bit of the brakes on. There's not an unlimited amount of desserts. We want to have structure and routine with offering dessert. We want to make sure that our children are offered and have available some of these forbidden foods so they don't become that sort of forbidden fruit. When foods are forbidden, we tend to overeat and tune out. So for desserts, it's appropriate to have a child-sized serving of a dessert, and it's important to let them sometimes have these forbidden fruits, but they can also just have the one serving of them. If we do this, this will help children feel good about eating, learn to like unfamiliar foods, go by feelings of hunger and fullness to know how much to eat, enjoy being at meals, and become more independent with eating. This will not happen overnight, and it can take time. It is about changing habits for a lifetime. It will be a process as your child becomes an adult. By following this plan, this will help parents enjoy meal times with their family, prepare only one meal at dinner, and not be short order cooks cooking different meals for different members of the family. It'll help them improve relationship with their child around food, and it will teach their children how to enjoy eating without feeling guilty and sneaking. It's really important for you to do your job as a parent, what, when, and where about food. Once you do your three jobs, then children are able to do their jobs more successfully. So here's another real life situation that's something that we hear commonly in our program. So take about a minute to read this scenario together, and then as a group, discuss what you would suggest as their medical provider. Okay, if you need more time, feel free to pause this. Now, this scenario we hear every single week. So what you might want to do in working with Molly's mom is discuss with her the importance of having structured meals and snack. Even allowing a piece of fruit, even though it's considered healthy and low calorie when it's not time to eat, keeps them from sticking to that routine. Allowing Molly to fill up at meals and snacks so she's not searching for food in between. So putting in this division responsibility in this case, we have seen work wonders. Getting them to eat on a schedule, but lifting that restriction at meals, letting her fill up during meals, but then instituting that process of between meals and snacks, it's not time to eat. What we notice almost every single time is those complaints of hunger, that overeating, that really large appetite starts to go down, and you start to diffuse this tension that you're seeing between Molly and her mom. Here's another real-life situation. So take a minute to read this together and discuss what you do as a medical provider. Okay, so let's talk about something some suggestions you would make to Bryce's dad um, with this new diagnosis of obesity. Well, I think a great one to be is to set a schedule for meals and snack. Immediately you're focusing on the when and where instead of focusing on the what. He can trust Bryce to eat the amount that he needs because that's going to be his father's response to getting this diagnosis of obesity of he's eating too much. It's likely that the parents were already concerned about his weight, and that is why they stopped buying junk food. This typically is just one piece of restriction in the home and could lead to Bryce actually sneaking and hiding food if they begin focusing on what Bryce has been eating within the home. The goal is to help the parents control the schedule and not try to control the intake of food. As we discussed earlier, research and experience shows if we try to control the intake of food, it's going to backfire every single time. These are some of the tools you'll be given at the end of the 6 sessions to help you with talking to families about Ellen Satter's division of responsibility. In session 6, we'll walk you through how the handouts can be used to help families in your practice. You can see with this handout, it really focuses on telling parents what their role is and what their child's role is. This is the back of that tool which you'll be provided that talks about the consequences when parents try to restrict what their children are eating, that their children tend to eat more. When parents pressure, the children tend to eat less of the foods that we oftentimes are wanting them to eat more of. When parents use food as a reward, children tend to adjust the preferences of the food. A great example is you have to finish your broccoli before you get dessert. What we know is that makes the kids like broccoli less, and it makes them like that dessert even more. And when parents worry about their children's weight, children can oftentimes feel that pressure, and they'll react to that pressure in a lot of different ways. Here's some good examples, expanding a little bit beyond necessarily about eating. When children say something like, "This is nasty and I don't like it," you might say, "You get to choose whether you want to eat that food at all." Sometimes kids are actually kind of shocked at that. "Can I have more to eat? I'm still hungry." "Yes, you can serve yourself some more." Slowly putting these into effect While initially will seem opposite of what parents want to accomplish, in the end will help them get to a healthy relationship with food and will end up improving the child's health in the long term. Here's another example of things that parents might say instead of trying to say it in a different way. I've told you 1,000 times, go wash your hands. Another way might be able to say, what do you need to do to get ready to eat? Again, taking away that negative interaction, but giving the children the respect and autonomy and letting them know what their role is. And also provided is this teaching tool about weight, given this is going to be one of the more difficult problems that we address with children and their families, and how as a healthcare provider and as a parent, how we can be helpful and how we can be harmful in what we do. But we'll go over this a lot more in session 6. So what should parents expect when they're beginning to use Ellen Satter's division of responsibility? Well, it takes time to make changes. Be patient and keep practicing it. At first, you may see that children are eating more than usual. Once parents are no longer the food police and trust their children to do their role, they'll begin seeing changes with their eating. We see this every single week in our program. Mealtimes will be more enjoyable for everyone, and family relationships around food will improve. And we will know when DOR is working when children start to leave food on their plate. They begin to try new foods on their own. They don't hide or sneak foods. They don't beg for foods as much, and they'll begin following that meal and snack schedule on their own. I know I've said this 100 times. We see that when parents are putting this in place, we see this positive changes start to work, and in the end, we see their children's weight begin to improve. But it does take time, and it does take practice. There's a lot more resources that can be found on this. A great one is the EllenSatterInstitute.org. 2 of her more popular books, Secrets to Feeding a Healthy Family, and Your Child's Weight, Helping Without Harming. She also offers a lot of webinars that you can find on her website, as well as free YouTube webinars on Ellen Satter's division of responsibility. So again, to finish this up, we want you guys to take a few minutes and discuss this together. Some of these topics that we've covered will seem a little different and can take some time to process. So talk about them. If you have any questions about this presentation or any of the other presentations, please feel free to email us at brennerfit@wakehealth.edu. Say that you have questions about the CME presentation, and we'll get back to you as soon as we can. Thank you guys for your attention, and I hope you enjoy the rest of this continuing education program.